the recipe for reversing type 2 diabetes is ideally you want to work with your doctor. So if you find out that your blood sugar is higher than it should be, you want to work with your doctor and start making a couple of changes. There's 3 lifestyle changes you want to make. The first is losing weight if necessary. So as I said earlier, excess fat, especially around your tummy, so if you have that tummy roll of fat, often leads to type 2 diabetes. And it's because the fat builds up in the abdomen and that raises your risk of insulin resistance. So if you need to lose weight, that's the most important first step. Again, simple but not easy. Second step is changing your diet. So eating the right kind of food and the right amount can have a huge impact on your blood sugar. What does this mean? It means the same diet we know we all should be eating. Cut out junk food, cut out fizzy drinks, cut out cookies, cakes, sweets, ice cream, all the super sugary stuff. Cut out takeaway, and then try and steer clear of white refined carbs. So that's things like white bread, white rice, white pasta. Some people say you should cut out carbs completely. Others say that it's okay to have them as long as you have the healthy carbs. So healthy carbs are things like sweet potato, butternut, some fruit. And the goal is, if you look at your plate, you want half your plate to be full of green leafy vegetables at every meal. Broccoli, spinach, salad, half a plate. Then the other half of the plate is divided into 2, a quarter of good quality protein. So that means eggs, fish, chicken, meat with the fat cut off. And then the other quarter plate with good quality carbs. So that would be brown rice, sweet potato, butternut, all the whole grains. Whole grains are good because they have fiber. And then a small amount of fat, the good kind of fat, which is avocados, olive oil, that kind of thing. So the 3 ingredients: lose weight if you need to, change your diet, and get active. So when I tell people to get active, I can see them rolling their eyes because they're like, don't want to go to the gym, can't go to the gym now. Can you go to the gym now? I don't know if you can go to the gym. You don't have to go to the gym. You can go for a walk around the block for 20 minutes, 5 days a week, 20 to 30 minutes, 5 days a week. So what we should all be getting into is that every day we move our bodies in some way. Weight training, so lifting weights or even lifting 2 1-liter water bottles can be really good for you. And again, there's so much advice and information about this. We have it all on our website. But the idea is to get your body moving, eat the right kind of food, and lose weight if you need to. And if you're working with your doctor and you've managed to be diagnosed with type 2 early enough, then that's all you need to be able to reverse type 2 diabetes, which is amazing that it is so possible. It's within our reach, and yet people are dying of diabetes in South Africa. What's interesting is that none of this advice is specific to diabetes. So we have an easy way to remember what to do if you already have type 2 diabetes and you're trying to live a healthy, happy life with diabetes. We tell people, remember TEAL, T-E-E-L. T is take your medicine, E is exercise, E is eat healthy, and L is lose weight if necessary. If you want to prevent type 2 diabetes, it's E-E-L, EL. Still need to exercise, still need to eat healthy, and still need to lose weight if necessary. And the truth is that this is the information that we all should be living with, because this is how you live a healthy life. If you want to reduce hypertension, high blood pressure, it's a similar situation. If you're struggling with obesity, it's a similar situation. None of this is specific to diabetes. It's specific to how to live well and how to live a healthy life. So I would really encourage you, if you feel that you might be at risk of type 2 diabetes, or if you feel that someone in your family might be at risk of type 2 diabetes, check out sweetlife.org.za or join us on Facebook on Diabetic South Africans and just inform yourself. So knowledge is power, right? The more that we know, the more that we talk about diabetes, the more that we normalize that this is actually something that we should all be having a discussion about. And if you're over 45, it's your annual diabetes screening, the less of a chance that people are going to be getting really ill with diabetes, because it's completely unnecessary. It is not a lethal condition. It should not be killing people in South Africa. So I really want to encourage you to know your status. The way we all know our HIV status, we should all know our diabetes status. And again, my name is Bridget McNulty. And if you would like to find out more, we are on sweetlife.org.za and on Facebook on Diabetic South Africans. And I really want to thank Allegra for inviting me here today, but also for empowering us to get a clearer picture of what the diabetes situation in South Africa really looks like. And they're able to do that with their excellent help.